an executive to CEO to GMs and so on, right? And I think quite a number of questions also revolves around culture. How can we erase that stigma, and how leaders actually can shift that cultures. And of course, we got a couple of very practical questions as well that talks about how we can, do a program that is realistic and affordable, especially for organizations with limited budget. All right. Now, right, so before we start, I'd like to introduce CIPD a little bit more. CIPD, as mentioned, is a Chartered Institute for People Profession. Our HQ is in UK. We are a not-for-profit organization. We've been driving change in the people profession with our 160,000 members across the globe. We are the only chartered institute that bring forward this people profession agenda, right? And we work with different experts around the world to really champion a better work and better working life, right? And in Asia Pacific, what we do, we work with a number of government and institutes to really develop the HR standards, to develop that framework. We work with a couple of organizations, a number of organizations as well, to raise the standards and to bring HR as a strategic partner for the organization. And last but not least, we also support individuals through our qualification, accreditation, through our research and some of our events like the one that you are attending right now. All right, so if you'd like to kind of keep yourself updated with our resources, please feel free to scan the QR code there. That will lead you to CIPD Asia page, where we will continuously post some of the resources that we have for people profession. All right. So without further ado, let me introduce our very first speaker. I'm happy to introduce Rachel, our colleague from the UK. Hi, Rachel. Good morning. Hey.
Hello, Ansley, and hi, everybody in Singapore.
Hello. Had your coffee?
I've got my coffee. I need it because it's morning here.
All right, so Rachel is awake, everybody. Now I gotta get Rachel to share a little bit of insight about what research says about employee supports for employees' well-being. Rachel is very experienced. She has run quite a number of programs and presentations on this. And Rachel, I'd like to hand over the time to you. So Rachel, over to you.
Thanks so much, and good afternoon to you. Good morning to me, because it's 9 o'clock here. I'm in Brighton in the UK, which is about an hour from London. So I'm just so delighted to be able to speak to you virtually across the world today, and on this topic as well, because before the pandemic, health and well-being, supporting people's health at work was such an important issue, very close to my heart. And I think the pandemic has shown us even more, hasn't it, right across the world, how vital people's health is, and what role managers and organisations have got as well in terms of supporting people's health at work. Now, Ansley has given us a great introduction to the CIPD, but on the next slide, I just want to show you highlights on the right-hand side of that, our purpose at the CIPD, which is to champion better work and working lives. And we take that purpose very seriously. And because we do, that means that supporting people's health and well-being at work sits at the heart of that purpose as well, because we're not going to have a quality of life if we don't have an organisation that values our health and well-being as well. So it's really centre stage for us at the CIPD. Now, just want to take you through, if I go back, take you through some of the key findings from our annual health and well-being at work survey report. We've been running a survey like this for 20 years at the CIPD. And even though the survey sample was UK based, there's a lot of findings in that report that are relevant to most organisations anywhere. So I hope you will take the findings from that and find them interesting in terms of what I'm going to show you today. So what it shows is that mainly organisations are taking a holistic approach to well-being. So recognising that our well-being and our health is impacted by a whole range of different aspects in the workplace. And we just ask a question of organisations, HR professionals, what do you focus on in terms of wellbeing? What aspects do you prioritise in the organisation? And you can see here that I've just set out in descending order the focus of organisations. Top of the list you can see there is supporting good mental health. That has really increased in recent years. Then we have good work, so things like job design, work-life balance. Then we have collective social relationships, and so important, that aspect of well-being, because there is evidence showing how protective the effect can be for our well-being if we are supported by colleagues. And then values principle. So how do we approach diversity and inclusion? This really relates to the working climate in the organisation. Physical health, of course, so important. Personal growth, so what opportunities at work for mentoring, coaching, training, all those things that give us personal fulfillment and the opportunity to grow. And then good lifestyle choices, so important for our health as well. So things like exercise, good diet, stop smoking support, all these things that can be offered at work. And then financial well-being, because of course, if we've got terrible money worries, how is that going to affect our levels of stress and our well-being? But that's pretty low down the list, according to our findings. So that's just a little snapshot to show you. And then if I move on to the next slide, I want to look at now the pandemic. What has been the impact of COVID-19? Over the last 20 months, nearly 2 years really, in terms of people's well-being at work. And what came through strongly in our survey report is that there's a lot of concern for people's mental health. Now, when COVID-19 struck, obviously the risk to people's physical health from infection, from illness and so on was very immediate, very obvious. But it also quite quickly became apparent that the risks, the challenges to a lot of people's health was psychological as well. So many people have been dealing with so much in their lives and at work as well. So that it's good to see that there was recognition, a very high concern. Over 80% of our HR professionals were concerned about the impact on people's mental well-being. What was also good, if you see the graph that I've got up there, is that most organisations were really stepping up and putting in place additional measures to support people's health and well-being. And top of that bar graph, if you can see that hopefully, putting in place a lot of measures, but more focus on supporting people's mental health is top of the list there. And then secondly, we have providing support for individuals' needs and concerns. So we were really pleased to see that recognition that everybody's been impacted differently. Everybody's got different health and well-being needs. And so any support at work really needs to be tailored to that individual as much as possible. So I think that that's a very encouraging finding in terms of the support, and then other measures there as well. But moving on a little bit, staying with mental health though, because when we asked HR professionals, how effective has your organisation been in managing the mental health risks arising from COVID-19? And then we find that only just over half told us that they think their organisation has been effective despite all the measures that they've put in place. So that really does beg the question, why aren't all organisations feeling that they've been effective in terms of what they've been doing to support people? And I just want to move on now and talk about some areas that come through in the survey where I think organisations could focus more attention, and partly explains the lack of in that question, why isn't it that everybody is saying yes, we're being effective? So, unhealthy practices. What we found was some concerning findings in our research. First of all, around practices at work that aren't good for our health and well-being, we have presenteeism. In the and I know that you're familiar, I think, with this term in Singapore. Over the last sort of 10 years, it's really become very well recognised in the UK. So people working when they're ill, when they shouldn't be at work, when they should be at home, when they should be recovering, recuperating, getting better to come back feeling that they are well enough to work again. And we saw very high levels observed on the part of HR professionals of presenteeism. So first of all, 75% think that they are observing presenteeism of people working in a workplace. And then, of course, with so many people working at home over the last 20 months or so, even higher, 77% said that we're seeing it among people when they're working from home as well. And leavism, I don't know if you're familiar with this term, but you will be familiar with the concept, I think. It's really people using allocated time off, like annual leave or sick leave, to work. So again, they shouldn't be working. They should either be on holiday or they should be being ill and recovering. So high levels, as you can see on that bottom infographic. What these findings show us is that organisations haven't been doing enough, or not enough organisations have been doing enough to combat the risks of an always-on culture. And I think for many of us during the pandemic as well, especially with working from home, those boundaries between work and home have become increasingly blurred. And for many people, they're finding it perhaps more difficult to switch off, to have that boundary. Now, moving on to the next slide, staying with some of those causes, we can see that when we look at the top causes of stress at work, we can see that top causes work loads, unmanageable volume of work, and that is the case every year. And those need to be managed by organisations so that people aren't overwhelmed with the intensity of their work. But also, if we look at the second main cause of stress, we can see that a third say that it's management style. And this shows us how important the role of line managers are in terms of supporting our well-being day to day. And of course, they're going to influence workloads and volume of work and our deadlines and targets and so on as well. But also management style, that is also about the behaviour that line managers have, the relationships that they have with people in their teams, and how that can affect well-being. And this shows in a negative way how harmful the impact can be on our well-being if managers aren't trained, supported, guided, and so on in their people management role, so that they can have genuine conversations about work, about health, and so on. Just moving on quickly now, because we see that in even more detail here. If we look at this slide, it shows line managers and mental health. And we can see that at the top, less than half, 43% have trained managers to support staff with mental ill health. We don't mean from a medical perspective, which I'll come on to. So then it's not surprising with such a low level of training that just 38% think that managers are confident to have sensitive discussions and, crucially, signpost people to more expert sources of help. So low levels of confidence really in the role of line managers. And then finally, 31% think that managers are competent to spot the early warning signs of distress, mental ill health. So that's what we need to focus on really. Really quickly, this slide, because we've got two great speakers coming up. What is the role of line management? it can be a virtuous circle if all these areas that I've set out here in this diagram are paid attention to. So line managers, no, they can't be expected to be medical experts or counsellors. They need the training so that they know where the limits of their role is, where that line lies, where they need to refer to an employee assistance programme, doctor, an occupational health department if you have it. But moving around, starting at the top, they do need to build those supportive relationships. They do need to be alert to any signs of stress and distress. If performance, if behaviour is changing, it's a cause for concern, someone isn't coping. And they do need to feel comfortable and confident to have compassion, have supportive check-ins, one-to-ones, and check in on people regularly and discuss what support they might help. Because in that fourth square round, the gateway, they really are that gateway, the main link very often, especially if people are working from home, between the individual and the rest of the organisation. They really play that gateway role, and it can be such a positive role to play if they are signposting and bringing in helpful policies that could help from the organisation, letting the individual know that there's this support available, making changes and adjustments in somebody's job or to their working hours to help them balance their work and their home lives and their health as well. And then finally, they can be healthy role models for their team. So to do that, they need to know what their role is to support health and wellbeing, and they need to know the impact that they have on people in their teams as well. So they need to practice healthy self-care practices, and be supported by the organisation. Now, just a couple of reports there to take away with you. We've got our guide, really good practical tips around the role of line managers in supporting mental health. And there is the link as well to the report that I've been talking about. So I will stop sharing there and look forward to the discussion and the other speakers.
All right. Thank you. Thank you so much, Rachel, for the insightful information. I thought it's very enlightening to see that actually, hey, mental health is the main thing that organizations see when it comes to looking after the well-being of their staff, and part of that is really the line managers and the management, right? And how we can kind of promote that together in an organization, right? Thanks so much, Rachel. So next up, I'm very happy to introduce the next speaker, Dr. Morrison Lowe. He will be answering this question: why does well-being matters to organization, and what more can be done? So, Dr. Morrison Lowe, are you there?
Yep, I'm here.
Yeah. All right.
Thank you,
So,
Ashley. Okay.
all right. So I'm gonna pass the time over to you, Dr. Lowe. Thank you.
No problem. Right. Let me try to get this. Right. Do let me know when you guys can see my PowerPoint deck.
It looks good.
Okay, good. So thank you very much. If at any one point in time I start to delve into the bad habits of doctor throwing out acronyms and technical terms, please stop me, all right? Okay, so basically I split the view of well-being into three facets: social, physical, and mental, right? This is the same as how we look at clinical aspects of things. Each of them play an equal and important role in the entire well-being of any employee or individual, right? And all of them, they are not mutually exclusive. Think about it. How can you function properly without a good, strong body, right? But at the same time, what operates the body? What controls the arm, legs, eyes, hand? It's your mind. You need a good, strong mind in order to make all these engineering works, these body parts start moving in the right direction. And more importantly, the famous quote saying, "No man is an island." You need people around. The social interaction is very important. Okay. I think the last 2 years have taught many of us the importance of social life, or social well-being, right? There are tons and tons of reports and data out there. I don't have to flood you guys with numbers to show how a happy employee working in a good environment with very supportive teammates and employer leads to stronger and better productivity. Okay. Also, the social interaction is so important. I think if you ask around, people will now tell you the importance of that lunchtime with the colleague, the pantry talks. Why are they so important? Think about it. Many of us serve multiple roles. We are an employer or employee, father, mother. At the same time, we are also spouses of our partners. And for those small pockets of individual who are lucky enough, you are also the son or daughter of an elderly individual staying all under one roof. And if you think about it, how are you going to encapsulate all these roles in your day-to-day life? It is because of the dedicated time. You know that every Monday to Friday in the past, 8 to 5 or whatever time you're working, you serve the role of an employer or an employee. When you're back home, before the kids go to bed, you're the father and the mother, and thereafter you play the role of a spouse. With COVID, everything collapsed into one. You suddenly realize that, oh, working from home doesn't really mean just working from home. How many of you think about it, you're struggling with replying your boss urgent email at the same time your son or daughter is asking you about a quick math question, and if you have elderly at home seeking your help in providing for meals or help in some of the household tasks, you realize that all the roles that you used to be able to hold are all collapsed into one, and you're suddenly overwhelmed. And this becomes very real, right? In the past, talking to your colleagues, able to brainstorm certain ideas or quick coffee chat in the pantry room gives you that extra idea, that spark to get along with things at work. Or just the verbal eye contact, the soft touch of the fidget of the boss shoulder will tell you, oh, okay, I'm making a mistake, I have to do something different. Imagine losing all of that and it becomes very real. Next, physical well-being. We all know how important it is to have a healthy and strong body to be able to execute and deliver all the things you need to do both at work and at home. All the HR, all the human capital resources, they are very well versed in ensuring that individual employee has good health insurance, health screening. They set up many different activities to get all the staff coming together. As much as building camaraderie, it also helps to improve the health of the individual and motivation and work coming together. There are many reports like this to show that how a healthier workforce equates to more efficient and productive workforce, right? These are some of the examples that my company, Raffles, has initiated to get people coming together for healthy activities. You often heard about, after work, grab a drink or coffee, Friday night pub time, right? Yes, those are probably important from social aspects. But coming to work earlier half an hour or staying back 1 hour after work to come together for all these work sessions, all these individual game sessions are equally important in building not just physical but also mental well-being. Right? We have come up with many different ideas to get people coming together. Physical activities doesn't necessarily mean running a marathon or going for games or sports. It could also be little activities like this at home, a virtual gardening session, teaching each other or showing how much of a green finger you are. These are also physical activities that can help with strong interaction in this time and age through virtual connections. Okay. Office ergonomics. I think this is no stranger to many of you. Back pain, shoulder aches, headaches. These all stem from sitting in the same chair in the wrong position for hours, leading to many aches and pains. Right. So all these are little examples of how we get people coming together to pay a bit more emphasis on the physical well-being and what you can do, the little things you can do to help out and to encourage people to pay more attention to that. Now, I want to spend a little bit more time on this part, okay, which is my personal passion also, right? Mental well-being, mental health is just as important, if not, in my opinion, even more important than physical. Many of you know that the term prevention is better than cure. Many of us know the importance of going to gym, exercise regularly to keep our body strong. The mind is also a muscle. We need to keep it strong. You don't just wait for someone who has, mood disorder or anxiety issues before bringing the individual to see a therapist or see a doctor for that matter. It is also important to keep them mentally healthy and strong. And what can you do to do all those things? You have many terms like mind gym, mood classes, meditation, mindfulness. These are important to teach an individual how to compartmentalize, how to process their train of thoughts, how to handle and manage stress. Right? These are encouragement we need to be able to bring up and talk to the people around us properly. Right? Think about it. When you're constantly worried about something, when you are low in motivation and energy, how are you able to engage better and make right decisions? Right? As an employer, as a line manager, what can you do? Have you ever asked yourself, who is the person sitting next to me, the team below you? How well do you know them? I've done a survey before. I spoke to some of the line managers before. I mean, many of them don't even know, the last name of many of their teammates and team members. Think about it. These are all very real people with families, with elderlies, with parents, depending on them and working for you. If something happened at home, how can they function just as well without all these issues and baggage, right? We have done many initiatives to help different corporates to engage the employees better. Simple 5-question to 10-question pulse survey. Ask them what's happening at home, any issues with the recent home-based learning for children, any struggles recently with the stringent work from home. Listen to them actively. There's a difference between sitting down and hearing them and actively listening to them. One of the best way to allow people to touch on topic is not to throw out information about depression, anxiety, OCD, schizophrenia. People turn away from that. Think about it. If someone's sitting in front of you and you know that he or she recently had a heart problem or been diagnosed with diabetes, how easy is it for you to ask, how have you been? How is the injection of insulin doing for you? You might even be mindful enough to be careful when ordering food for the individual, or when you give a gift, you might even be mindful enough to order something that's low in sugar, just because you're aware. But now, change that perspective. Imagine the one sitting in front of you has been diagnosed recently with a mental health condition, anxiety disorder, mood disorder. How would you react? I've seen many people don't know what to say, and the easiest way for them is to walk away or avoid. And that's actually more detrimental. The best way to break through this barrier is to talk about it openly, educate people, make them aware of all these problems. What are the things to look at? crisis management. Someone at home recently gone through a bereavement, especially in this time and age, in this current landscape. This is getting more and more real. What can you do to reach out to help them? Train the trainer program. Help the line managers identify the red flags. People don't usually come to you and say, I have a mood disorder, I have an anxiety disorder. No. The first few telltale signs will be headaches, difficulty sleeping, insomnia, low in energy, aches and pains. These are some of the first telltale signs, and you see recurrent medical sick leave or getting late to work and stuff like that. The first thought is very easy to think of the individual in a less than better light. But have you ever looked at it from the lens of a clinical aspect? The other thing that we have come up with is initiative for Raffles Healers. As I mentioned, coming with all this medical terminology and stuff, in a way push people away because it's too intimidating. Like it or not, the stigma for mental health is still very real and out there. So we turn it around, make it more lighthearted, come up with short articles, videos, podcasts to teach people how to identify both people around you and also yourself that, hey, something is wrong. I need to watch out about my own health. I need to pay more attention to my own mental health and well-being. Come out with dedicated contact point and people through social media and all. Think about it. You as leaders of the company, if you step up and do a campaign telling people that, hey, look, mental health is important. I also have my anxiety issues. I also feel burnout. Do not, undermine all these things. If we as leaders can stand up and take the lead and charge, people below us will be more readily to step up and talk about it and share with you. Prevention, education are the first piece that we can come in to help them. Next is the intervention. Many a times, mental health conditions are chronic illness. They don't just go away miraculously. It takes a lot of maintenance and support and care. So be there for them. It's an entire journey from start to the end. I know my time is very short. I promised to finish in 15 minutes or 10 minutes. I saved myself one final slide for a simple case study I wanted to share with everybody. I thought this might be something that might be quite useful and interesting to many. One of my roles is to play as a medical director is to do medical board reviews. HR would often send employees to me to say, look, doctor, this employee often take medical sick leave every Monday and Friday, and when he takes like 2-3 days. Can you take a look at it, find out is there anything wrong, or is this guy just trying to malinger? Sorry for the choice of words. Spoke to the individual one late Friday night, spent 2 hours sitting down talking to him. Then you realize, recently the individual, the poor guy, has gone through a series of bereavement. His grandmother, the carer, recently passed away, along with his shortly after, followed by his father. Thereafter, gone through a very bad breakup. Things at home is not doing well. His sister also suffered from bipolar, and everything comes crumbling down. All the time he has taken was to seek professional help outside, but he was too ashamed to share. And mind you, every single counseling session can take its toll on the individual. You don't just go and see a therapy and open up and share all your trouble and then go back to work happily. There is a downtime. When you try to open up something painful, it can linger on. Think about that, imagine telling someone, a stranger, your deepest, darkest problems, and then expected to go back to work cheerful. So that was something that he had struggled with very badly. Thereafter, getting his consent to share this with HR, I managed to speak to the employer and HR. They understand, gave him some time off to settle whatever needs to be settled at home and his problem. He came back 200% better, stronger, more productive. Stayed with the company more than 10 years. So this is something that we can do individually. If we only allow ourselves time to let the individual share their problems, I promise you, you'll come back and the rewards will be tenfold. And with that, I think I better end my presentation. Thank you all very much.
Wow. Thanks so much, Dr. Loh. I think it's very fantastic sharing. Very very heartwarming too to see that people are treated as people, right? So next up, I would like to bring our attention to our next speaker. Our next speaker is none other than Pauline, Miss Pauline Chua, who is the director for Group Human Capital, right? So we're gonna talk about are your line managers trained, equipped, and what about self-care? Yeah, so we look forward to hear good stuff from Pauline. So I'm gonna pass the time over to Pauline. Pauline, over to you.
Thank you, Anson, and also Morrison. Good afternoon, everybody, and of course, good morning to Rachel in the UK. Very privileged to be here to share about this very important topic, and I truly enjoyed that very heartwarming sharing by Morrison earlier, where we are getting into the health and the heart and mind of someone who is truly suffering or stressed mentally. I'm going to take a slightly different slant on this topic, and I'm going to share the slides. Let me know if you have problems seeing the slides. Give me a second here. Okay, I believe you can see this. So health and well-being at the workplace, we are going to talk about it a little bit on in terms of, give me 1 second, just let me see how I can, yeah. In terms of employee experience, yeah, I guess our challenge now is how do we reset, if possible, employee experience with all that's going on around us to create a more meaningful, lasting, emotional connection with our employees. That's something that can't be emphasized more at this period. So never before have our employees' lives been so dramatically impacted so quickly. Imagine starting your first day at work, working from home, or meeting only half your team members face to face and the other half online. So the pandemic has certainly been, while it's been devastating, it's also presented us with opportunities to redefine the whole employee experience in ways that fits this new normal. And help leaders address their employees' experience in a more targeted and dynamic way. So with working from home, of course, the lockdowns, economic downturns, employees have had to adjust, yeah, and our challenge now is to rewire, relearn how to attract, develop, engage, retain our talent. So it's not a one-off, but the sum of all the different experiences that an employee has from the time they join an organization, how their careers develop, and how engagement is, how we engage them. Yeah, so how do we keep them connected? That's more the question, and productive and supported during this whole journey with us. And on top of that, ensure their health and well-being. So with prolonged work from home, remote working arrangements, many employees feeling zoomed out or Zoom fatigue or Microsoft Teams fatigue. Truly, there's been a lack of demarcation from work and home life. So at the expense of mental and physical health too. So managers, line managers truly need to clearly and openly agree and discuss milestones and results to add some form of structure and remove some of the confusion and uncertainty that comes from working and managing from home. So a clear focus on outcomes would certainly help. Early this year, just to give you insight of what's been happening in the healthcare industry, I'm sure you can all relate to this and see this popping up everywhere since early this year. We were in a call with MOH, Ministry of Health, to set up 15 vaccination centers island-wide. So it was a monumental task because we had to spring into action Within 5 days, we set up our first vaccination center in Terminal 4, and by 9th of February, 36,500 frontline aviation workers had received the first dose of the vaccine. Yeah, so truly a race against time. And we, as in human capital, form various task force with operations and IT working around the clock to ensure smooth operations of the vaccination centers. And even our own employees, nurses, doctors, all came forward to help out. So as such, we extended our healthcare services and solutions to beyond our hospitals and clinics, to the airport, cruise centers, dormitories, and community care facilities. And it also was important to redeploy our manpower and services to where they are most needed when the pandemic hit us hardest. So it's not a surprise, Raffles Medical being in healthcare. A study was done, although this was last year, that there's a prevalence of stress and anxiety among all healthcare workers, whether they were medical or non-medical employees. As such, issues that our employees face include exhaustion, COVID fatigue, sleep problems, loneliness, isolation, feeling a bit overwhelmed. And we can do a lot, I believe, as line managers. And this is just a little flow chart here, making sure that everyone is taking breaks, truly taking a timely break provides our employees for a mental break and reset. And it clearly communicates when line managers ask the employees to take a break that their well-being matters. Yeah. So, and also speaking to employees in a confidential space, because it can be sensitive to talk about struggles in their work or in their home or in their personal lives. Yeah, and let people know about the support available. It's great if organizations, we do have a employee assistance program where they can get access to our counselors and keep checking into them. People need different things at different times. Communicate without judgment, while it is on employees to express their concerns. Line managers also can practice sensitivity and listen intently when they speak up. Yeah, and later on I'll share with you a self-care tree, which can be displayed in your pantries and rest areas as a gentle reminder for employees to take care of themselves. And of course, don't feel that you have to do this all yourself, by yourself as line managers. That's also partly the role of human capital or HR. So of course, we covered this earlier. I think Morrison did a great job, importance of breaks, annual leave, and notice at line managers if your employees are really working overtime and really reach out to them and check in with them regularly. Don't wait to offer help. Encourage them to seek help. And shift workers especially do get sometimes very erratic shift patterns. If possible, provide schedules that are as predictable as possible, and areas where they can take a break and just refresh. And check in regularly, of course, whether it's a virtual morning call or end of day call on just discuss any challenges that they may have faced during the day. And so that's very key. And earlier, Rachel did say that line managers are the gateway. Okay, something that we did over here, we in terms of engagement, we feel that it becomes even, we believe that it's more critical in challenging times. And so we did a little campaign or competition where we encourage the different departments to put up words of encouragement for each other, and then we publish these words of encouragement. This was done last year during the whole circuit breaker period. So that communication is key. We need to clearly encourage managers to also clearly and openly agree, as shared earlier, on the different milestones. And it's important for them to also address how roles are changing with their employees, and help them clearly understand their new roles and expectations. Yeah, so recognition is certainly very important to help them feel appreciated, valued, and how they have helped the company succeed. And in this new world of work, it's also important to ensure that we are living our company values. For Raffles, it is our values of compassion, commitment, and also in the areas of teamwork and bringing value to our patients. Yeah, so it is a good time to review that, to give everyone a sense of purpose. So this is just a company-wide promotion exercise we did, and we tried to make it fun with Mentimeter and everyone voting videos that were shared on the best videos to recognize fellow employees. So over here, this is just an overview of our range of health and wellness initiatives and activities. One of them is a resilience workshop that we intend to roll out to also provide line managers with the training and all our frontline ancillary employees on how to regain that sense of control over the situation and to be resilient in such times. So teleconsult, this is something we provide as a service, not just to our employees, but to the public, where they can have a 24/7 video consultation with our doctors and our specialists. And so if you don't have this, do download it. It's very useful. Keeps all your personal records, vaccination records, and you can also purchase some of our medical products online. Yeah. Okay, so this is something that we just kicked off to encourage booster jabs for all our employees. These are photos of some of our leaders who've taken the jabs, and it speaks volumes when senior management, set the tone for well-being of our employees. In this case, of course, it's physical well-being. So line managers, you're not alone. You do set the tone for sure. And with the support of senior management, line managers, it basically sets the scene for a very healthy partnership with human capital, and it's important, line managers, that they also look after themselves in the process. This is a self-care tree that you can print out if you want, and put it as a gentle reminder for all employees to take care of themselves, communicate and share feelings that they may be having or struggles that they may be experiencing. So in conclusion, really the ultimate goal is to develop a workplace culture that embraces openness and authenticity, where it's okay to talk about emotions, our struggles, our capabilities and limitations. It's important to recognize our employees, make them feel part of a larger purpose. After all, our employees are an organization's greatest assets, and we need to dedicate resources to improve employee well-being for sustainable growth. So the challenges and learnings from this pandemic, we believe, will certainly fortify us for years to come. Thank you very much.
Wow, thanks so much, Pauline. I think that's amazing sharing with a lot of practical tips for the line managers. I'm sure the managers, if there's any line managers here, they will appreciate that. It's very, very practical. All right, thank you so much, Pauline. Now, everybody, now we are going to the exciting part of this program, which is question and answer. How we're gonna do this is, well, we do not have much time, but what we'll do is we will try to address some of the questions that came in first. Yeah, there's quite a bit of questions, but I think I'm gonna choose one of them that I find very interesting and probably not addressed yet in the presentation. One question is this: what are some of the common signs of deteriorating mental health? Does that differ between hierarchy? That means from executive to the CEOs. Is there any different there, or what are some of these signs? Yeah, maybe the speakers, the presenters, maybe Dr. Morrison, you'd like to address that?
Okay. So you often heard this saying that the more senior we get, the lonelier we get. And actually, it's a very true thing, because sometimes it's always easier to, sometimes it's easier for the junior staff to talk amongst themselves in pantry. But if you think about it, if you're the CEO of a company, who do you banter with, right? So that solitude is very real. I do have patients of senior management level, and sometimes they come in with anxiety, saying that, they have so much stress, and all the time they have to keep themselves in check when delivering instruction, delivering bad news of the company, and many things like that. And everybody needs an outlet to let go. So for that, they will often get headache, inability to fall asleep. These are the two very common telltale signs, and they're all leading to anxiety. So they always worry about blood pressure. That's the thing that they worry about, and that's what they bring them to the clinic. If you talk to them a bit more, you take a deeper history, you realize it's more of an anxiety problem. For the junior staff, you also get that, but what you get is lethargy, fatigue, low in energy. These comes about with difficulties with sleep, appetite, weight loss. These are some of the telltale signs you would see. Someone coming in chirpy or dressed up. After a while, you see them, hey, how come, the makeup is off, they're coming in dragging their food, little soft tales like this, little soft signs like this are what you could pick up from.
All right, thanks so much, Dr. Morrison. All right, other speakers, there's any addition that you'd like to make? No, all good. All right, thanks. All right, we got one question about from Emily. What would be your advice on where to start with regards to mental health for businesses who has no formal well-being support or training or initiative? So how can we support? How can we start this, right? And I think another questions that came previously was this: how can we implement a realistic and affordable ways, for this wellness program, especially for organization with limited fundings. All right, so maybe I would invite Rachel to address that.
Yeah, I mean, really loved your presentations, by the way, Morrison and Pauline, just brilliant. Really good questions. And I think a lot of organisations start from very little when they want to build a workplace that supports good mental health and well-being and so on. And a lot can be done with very little money or no money, because I think if we pare it right back and think about, well, what are the most important sort of activities in an organisation to support health and well-being, then it isn't necessarily having expensive initiatives, expensive gym memberships and all those things. I think it really starts with those fundamentals, and it does mean getting leaders and senior managers on board so that the values and the working environment and the culture doesn't contradict what you're trying to do in terms of sending out that we care message, which I thought was brilliant on the Raffles slide. So it starts with the culture, with leadership, with the values you've got, and that good people management that we've all talked about, really, and getting those relationships and that trust right. And I think in terms of mental health specifically, because we've come a long way in the UK in a lot of organisations, and I think the first thing is addressing the stigma, and just that can be done just by starting to talk about mental health. And it can just start quite slowly and gradually. And there's World Mental Health Awareness Days. You know, that's an opportunity for managers to just start talking about it and saying, look, we recognise that your mental health is really important. We value you, and let's talk about it. So it's not necessarily the policies that you have in place from a HR perspective are really important. So absence management, return to work and flexible work, and all those things are important, and great if you can have occupational health and all those things in place. But actually, it's about preventing ill health where you can in the first place, and then just having the environment where people can talk about their health and seek help. Excellent. There's a lot more, but
yes, thanks so much, Rachel, for the input. Now, I think I just want to address one last part of the questions, because I think a bunch of the questions that came earlier was about culture, right? And in fact, one of the questions asked, you know, how can we, you know, healthcare professionals are reluctant to talk about self-care for fear of showing their vulnerability and afraid of being judged. So how can leaders shift that culture? Maybe I would like to pose this question to Pauline. All right.
Okay, thank you, Ansley. I think that's a great question. On the note of culture, I think leaders can play a great part in providing that psychological safety for such topics to be even talked about. And they do set the tone just from their behavior and communication with their employees on this matter of well-being, whether it's physical, mental, or emotional. So a culture that embraces openness, a culture that is, you know, not afraid to take risks in a way, or you know, one that is fine about mistakes being made, but not more than once, I guess, for Singapore, does speak volumes about how well supported their employees are, whether it's from the work front, whether it is just on the social front of how they talk with each other. So you know, on that note, you know, that's where opening up about challenges that they themselves as leaders have faced and how they overcome it, you know, kind of helps open up this topic on showing some vulnerability and weakness, if you can call it that. And that in itself can be a strength to bond people together, to create trust, and to demonstrate that it's actually okay to talk and be open about such topics.
All right, thanks so much, Pauline. Right, we have a couple of more questions, but unfortunately the time is up. It's 5 o'clock, and we want to respect everyone's time. So yeah, with that in mind, thanks so much everybody for joining us. If you could just scan a QR code here, and if you could just share a feedback with us on how the session is run, we will heavily appreciate that. Right? Yeah, I've also put in a link there for you to put in your feedback if your device does not support a QR code. Right? So with that in mind, thank you so much everybody for joining us. We hope to see you again in our upcoming webinar. And yeah, thanks so much, Rachel, Morrison, and Pauline for being here, for all the advices that are so practical and relatable. So, all right. So thank you, everybody. Have a great evening ahead. All right.
Thank you, everyone.
Thank you.
Thanks so much, everyone. Really great to have the opportunity. Bye.
All right. Bye-bye.